All right. Welcome back to Talk About It Tuesday with Flint ReCAST. I am Robert Reed.
And I'm Alexis Love.
All right, Alexis, definitely glad to have you here with us on this episode because I know that you do outreach for ReCAST. And this is one of the gentlemen that is our guest today, Mr. Doron Pratt, outreach specialist. He's definitely the champion in the streets. So welcome, Doron Pratt.
Thank you for having me.
Absolutely. So we're just super excited. Let me let you guys know again, this is Flint ReCAST. And as always, resiliency in communities after stress and trauma. What we do is aim to assist high-risk youth and families by supporting the recovery and rebuilding of Flint's vibrant community. So in short, we look to cultivate change, work with our partners to collaborate and reshape the narrative surrounding Flint. Basically, that means we want to improve behavioral health, empower community residents, reduce trauma, and have sustained community change. And we know that we can't do that without you, the people.
Yes.
So
That's
I'm
right.
here because we're going to have a conversation about outreach. And I know that with Doron Pratt, that's his whole job, right, is outreach.
Nothing but the
people
truth,
are
yes.
Connected.
Yes, that's right.
And one thing I can tell you about Doron Pratt, a lot of you already know him. It's hard for me to walk around the city without people, hey, Pratt, you know. So I'm just excited to have this conversation with you. Welcome back to Talk About It Tuesday.
Oh, thank you.
Absolutely. So tell us a little bit about yourself before we get into it. I know you're native born. You're Flintstone.
That is correct. My name is Doron. I am a Doron Pratt. I am a native here of the wonderful city of Flint. I went to high school at Flint Southwestern Academy. Then I did a year at Mott Community College. And then after transferring from my community college, I went to the University of Michigan Flint, where I received my bachelor's in business, operational management, and my master's degree in public administration.
Awesome. Okay. So I know that you love the city.
Yes, I do.
And you want to see things go from one level and take it to a whole
Another level.
See, that's what Doron Pratt's about, right?
That's
Taking
right.
things to a whole.
Inside jokes over there.
No, ain't no joke. This all real. This real deal like Van Holyfield. So yes.
You know, one of the things I love about working with Doron is when I ask him, hey, man, how's it going? What are you up to? He always responds with something positive, like,
Yeah, living a dream.
living the dream.
Living the dream.
So living the dream, what does that mean to you, living the dream?
Living a dream. It's wonderful actually because imagine doing something that you love to do and getting paid for it. That's a dream. Something was more than a job. Is more of a lifestyle. Something where you can help people on a day-to-day basis to say, you know what, I made a difference in this world. I know one of my mentors, Mr. Tendaji Ganges, who passed away some decade ago. He said this remark as far as you want to make sure you leave a mark, not a stain. And I just took that to another level and said, okay, I want to make a difference in my community and the people that surround this wonderful, beautiful area.
Oh, that's awesome, man. Make a mark and not a stain.
Yes.
That's our responsibility. There's a lot of things that are outside of our control, right? But there are some things that we do have the power to influence directly, and I think that's what that philosophy speaks to.
Absolutely.
About, you know, what's your impact going to be today?
Yeah.
Are you going to make a mark and impact somebody's life in a positive way, or are you going to leave a stain? You're going to take it down, right?
Yeah.
That's right.
Yeah.
It's a great quote. And it just reminded me another one, you know, since you guys have your insiders. I can't remember who said it to me or where I read it, but it was be the change you want to see in the world.
That's right.
It kind of goes hand in hand with what you just said. We have to go out there and make some changes ourselves.
Absolutely.
That's
Be
right.
the change. So tell us a little bit about, like, I know you went to high school locally,
Yes.
Southwestern.
Correct.
What was your mascot?
The Knights.
The Knights?
Yes.
Okay. I know the little rival. Anyway, I like to always bring that up for those who went to Central and, you know, other places. Where'd you go?
Western. So I graduated from Mott Middle, but
Mott Middle,
you know,
okay.
Yes.
I'm gonna claim Southwestern, Whittier, Central because I went to all of those schools for at least 5 minutes or so.
There you go. There you go.
Yes.
All right. So you're the champion in the streets, right? one of your jobs, the program that you're working with, you're with Connecting Kids to Coverage program,
Correct.
which is a lot more than just connecting kids to coverage. So can you tell us a little bit about the program you work on now and the outreach that you're doing?
Absolutely. So I work through the Greater Flint Health Coalition in a program called Connecting Kids to Coverage, which we provided free one-on-one healthcare enrollment assistance into Medicaid, the Children's Health Insurance Program, which is called CHIP, and healthcare coverage, which deals with a lot of the Flint water crisis and making sure people are insured through that. But the concept we do as far as the outreach for Connecting Kids to Coverage, we want to make sure that we effectively reach, empower, and inspire parents to enroll their children and teens to keep their coverage up to date. And we want to make sure we meet the people where they are, approach to fostering mutual understanding, and how community members can get the scoop on family eligibility, child benefits, and how to apply for coverage.
Okay, so health insurance coverage, making sure that we're definitely covered. There's some special things that go on, and I'm sure that you get a lot of questions about, well, do I qualify, right? Is that something that's going to benefit me? So what is it that somebody needs to know when they want to enroll in health insurance coverage and they live in Flint?
Yes, well, you have two types of coverage. You have Medicaid and Medicare. So I deal with the Medicaid side, and that's funded through the state and federal level, and it provides healthcare services for those who are low-income adults, pregnant women or those who are expecting, children, people with disabilities, and also those who are over the age of 65 years old.
Okay, so that's the green card, right, from the state?
That is correct.
So if you got the green card for your health insurance, that's Medicaid.
Correct.
It's an income-based program.
That's right.
Okay. And I only say that because Medicare is typically you have a white card, and it's red, white, and blue. And typically you're older when you have that.
That's
but
right.
Sometimes you may have a health condition, and you may qualify for Medicare.
Yes.
And even some people may qualify for both. So it's possible for you to have a green card and a white card. So if somebody wants to come talk to you, do they need to have a card?
No, they don't. If they are within our eligibility as far as our income, so for one household income is the cap is $18,000. For two household income, it is $24,000. And for those who are 3 or 4 or more, as far as the family, is $36,000 or more as far as the income. And a reason why we want to make sure that we are providing services for those who are below 133% of the federal poverty level. So we want to make sure those individuals are insured as far as income, because the one thing that I'm finding out, or one of many things I'm finding out, if it's not covered, I'm not coming. So if I'm not, covered as far as going to the doctor's appointment, as far as getting these annual checkups, especially with men who are over 40, I'm not coming. So that's the problem. We want to make sure we alleviate any type of excuse so people can go and get the necessary healthcare coverage that's needed.
So go ahead.
But with those incomes being so low, I know they have a lot of other programs and a lot of other insurance available. Because
yes,
with those household caps, it's a lot of people might not qualify. So I just want to make sure they know about those other options that they have too. Could you talk about a couple of them?
Yes, we do have partnerships with Genesee Health Plan, which is a little bit more as far as the threshold. I believe one household income is $36,000, two household income is $54,000, and it goes up, I believe, $1,200 to $1,400 or so forth every other one. But they take up a little bit more as well. But we do work with some outstanding partners and agencies to make sure that even if they don't fit the income bracket that we serving, there's other agencies that can help as far as the income bracket is concerned.
So it's always going to be a benefit for somebody to come talk with you just to see if the program that you work on is going to be the best fit, or who else they need to talk to, and you can direct them to partners who will make sure that we do find some type of healthcare coverage for you. Right?
Yes, we want to make sure we do a warrant handoff, because a lot of times it's not what you know, it's who you know. So we want to make sure that we're connecting to the adequate resources or agencies that make sure that they have, because the main thing, we want to make sure that you are insured, you are covered, because once we insure our children, we insure our future. So we want to make sure that we have the necessarily capability to make sure people are enrolled as far as that. So that's what we work on as far as one-on-one enrollment and renewal, which is called redetermination.
I'm glad you brought that up because I was thinking about redetermination. You know, coming out of the pandemic, a lot of things have changed. And so some programs that were extended are no longer available, or you may have been eligible for something and some of those things have changed. So when you talk about redetermination, that just means you have to make sure, hey, this plan still is the best one for you. And there's a process that you have to go through to make sure that redetermination, you're approved for it. So can you tell us a little bit more about redetermination and what that looks like?
Absolutely. So redetermination, I know for some that might be kind of intimidating, like, okay, redetermination, am I getting served some papers? Is something I'm in trouble legally? But redetermination, we want to make sure that those who receive Medicaid, that they're still eligible for the program. So it's a renewal process that you have to do each and every year.
Every year?
Every year.
Okay.
Now, most people think, well, why do I have to do it each and every year? Once I have it, I have it. Well, a lot of things could change. Some households dynamics can change. Some people may, just recently got married and now this person is within the household and now the income goes up. Some people might say like, it's not working out. We have to separate or divorce. So now my income has drastically changed. I might have, more dependents within the household. So a lot of things we need to make sure as far as the state of Michigan, as far as the household income, the number of people living in the household, because if we don't have that information within the file and the systems, then that's when you see a lot of denial letters. Like, why am I getting denied? And I applied for healthcare and Medicaid. Like, well, you applied last year, but I did get married. I did have a new last name now. I am making, significantly more or less, or I did have a job before, but now we had to cut down on some hours. So that's what we need to make sure as far as having that those type of documentations to ensure that we do have the correct and accurate information as far as healthcare coverage through Medicaid.
So those things that you're describing are called life events. So any changes in your life, family size, status, employment, whether you gained employment or lost employment, any change from year to year may mean that you have to redetermine.
Correct.
Right? And am I going to get an email? Somebody going to call me? Or do I have to look at that boring letter that comes in and I kind of just throw everything in the trash? Like, how do I know as far as communication-wise, what should I be looking out for?
Yeah, so with the state of Michigan, they have been doing their due diligence, and they understand that letters are not just enough. They want to make sure they do a phone campaign, which I'm a part of, to make sure that we're calling people just as a friendly reminder prior to the redetermination deadline, at least a month or so prior till, and as well, but not necessarily. I want people to understand that when you get this information, to definitely give us a call or make sure that, when you do see the number on the your caller ID, that you either pick up the phone or call us back and answer, because a lot of individuals, once you're finding out that when people call, they think it's some type of scam or, okay, they want something. It's like, no, that's not the case. So we have to make sure that, okay, like, hey, I'm an agent through the agency affiliated through the state of Michigan. This is my identification numbers, and let you know the legitimacy of this phone call as well. So yes, you will get a letter in the mail that we advise that you look over, read over it, and it'll tell you what you need to do as far as items needed for redetermination, as well as the phone call as well. And then you can either mail that back to the state of Michigan, or you could call the number just to make sure, okay, hey, I do have the updated information. Or you can go on our website at MyBridges and make sure that you do have the up-to-date information that's within the system.
So the website, MyBridges, how do you spell that?
You have capital M, capital I, B as in boy, R as in Robert, I as in ice, D as in dog, G as in go, E as in Easter, S as in Sam. So you have MyBridges.org.
MyBridges.org. MyBridges.org.
Correct.
And one thing I want to say before we go is, although it might not come up for the redetermination until annually, technically, I do believe within 30 days you are supposed to report any changes in like income, household size, just about anything that they ask you about when you're filling out that application, if any of that information changes, technically you are supposed to let them know within 30 days. Otherwise, you may have to pay back some of those benefits.
That is correct.
30 days.
Yes.
All right, that's good to know. And then the phone number, like, is there a particular phone number that people can reach you at, or they should pay attention to? What does it start with? They may think they're just getting spam. Do you have any information on that?
Yes. Well, we do have a number you could call our program, Connecting Kids to Coverage, and that number is 810-953-2427. Once again, that number is 810-953-2427. So you can call, and you could get a call back from us about at least within that daytime period, but we at least give 1 business day as far as the turnaround time period to follow up as far as the client's request as far as assistance for Medicaid.
So what type of things, once somebody finds that they are eligible, they've done the redetermination, they have Medicaid, and they want health insurance coverage, what kind of benefits do they get as far as the coverage?
Yes, so the benefits we have that they're eligible for is doctor visits. That's included like annual health exams, dental, because a lot of times, like, hey, that is not cheap. So you have dental, visual, speech, hearing, of course, prescription drugs, x-rays, family plan, pregnancy care, emergency visits, mental health services, surgery, physical and occupational therapy, and nursing home health care, and hospice care.
Wow.
Yes.
So it's a lot.
Yes.
All you got to do is tap in.
That's right.
So don't ignore the phone calls. And if you don't trust the phone call because you're like, I didn't call nobody, well, now you know you can call Mr. Pratt.
That's right.
At 1-800,
810-953-2427. Say it with me, Robert. 810-953-2427.
I got you.
And Mr. Pratt has your back.
Absolutely.
That's right.
Pratt has your back. We should have some shirts and some hats.
Yeah.
Pratt got your back.
Sound like a legal term. Pat has your back.
Copyrighted.
Yes.
Now, I know people are going to see you out at community events and different things. You're always out. I'm not sure if there's anything that's coming up that people should be aware of, because we're in like at the end of the year, like the last quarter. So as we go into, the last few months of the year, how often should they be looking at redetermination? Does it happen like in January, or can it happen anytime throughout the year?
It varies from person to person. So if, like, let's say you started the application process in October, then it'll be actually 1 year from the day that you applied and got approved as far as for Medicaid. So, and a lot of times on the back of your card, I believe the last 4 digits, those are, you could determine as far as like, hey, what is the date that I need to apply for Medicaid? So, or redetermination. So if it's like 01, of course, January 02, February, and so forth. So that's another indicator as well. But mainly it's the date that you got approved for Medicaid. So 1 year after that, that's when you have to look as far as redetermination at the end. And also, if you are like, okay, well, the deadline passed, it's October 31st, I'm supposed to do redetermination, now it's November 2nd, the state gives you at least a 30 to 45-day grace period to make sure they get that information. So it's not like you instantly lose your Medicaid. It's just put on a pause button. Say like, okay, we need this information to make sure, usually it's like the household income or any type of income. So if you're getting SSI in the household income, they want to know that. How many people are in the house? If it's 3 or 4, they need to know how many people are working, what type of income flow is going in the house. They need to know all this, the last 30 days of your paycheck stub. So they need to make sure you have all this information. So even if you do pass the deadline for your redetermination, you do have at least a minimum 30-day grace period to make sure that you're getting that information, so that way you can have your information active. But right now, once you pass the deadline, it's basically pause button.
Okay. And I know with the website, again, just the mibridges.org,
Yes.
The reason why you want to share this information, because I know it's a lot, is because, not only healthcare, but you have food assistance, right?
Yes.
What are some of the other things that you have that are connected to MI Bridges in this qualification?
Well, you have five resources available or benefits available through My Bridges. You have the first one is healthcare coverage, the second one is food assistance, the third one is cash assistance, the fourth one is child care, and the fifth one, that's the emergency relief. That deals with those who are below the poverty level that needs assistance as far as utilities, barrier costs, or housing expenses.
Okay. So help us help you. Help us
Yes,
help you.
that's
You
right.
got to talk to Pratt because he has your back.
Yes.
That's right.
All right. Anything else you want the folks to know about how to connect with you or, any identifying information? You had mentioned if you do call, there is a way for you to identify yourself. Like, is there like a number or something that they would have to know that this legitimate?
Well, usually when I call them as far as the redetermination and make sure that, hey, this is not a spam call, we do have what's called a community partners ID number that we provide and give out that verifies that we are certified through the state of Michigan as far as providing enrollment services and help as far as redetermination. So that way, if they do feel like it's a little bit sketchy, they have that our ID number, so that way they can go back and verify it if they choose to on their own time. But I just want to also mention that you can go online as far as either applying or redetermination through the mibridges.org, and just the process of it. If you're new to this particular website, as far as MI Bridges, which is very, very helpful. You want to make sure the first step is once you go on there, log in, click on the login button. They'll take you to the page where you can enter your username, password. Once you do that, log in your credentials, your user ID, and then right there, it'll take you to a verification to make sure that you are you, because identity theft is real. But I just want people to know that it's a simple process. It usually takes 30 to 45 minutes if you do it online. If you meet with myself one-on-one, face-to-face, we usually take about an hour because we want to do a step-by-step guidance as far as making sure that we have all the information needed, because sometimes people might feel I might click on the wrong thing and now I don't have my Medicaid or I did something wrong. So I want to make sure I empower them and educating individuals to make sure we can get the correct or needed information within the system.
Awesome. So we appreciate you, the champ.
Pratt's got your back.
Pratt
Get it.
has
That's
got
right.
your back. I'm trying to tell you. Make sure you lock in with Connecting Kids to Coverage. You can always find Mr. Doron Pratt as your outreach coordinator. And of course, if you have questions, you can email us at recast@flint.org. Appreciate you all.
Thank you.
Thank you.